Welcome, I'm Kevin McDonald and you're watching Eye on Business, and with me tonight is Nick Terrafranca. Nick is the CEO of NeuroRecovery Technologies, and you know what, he's also the winner of the NextGen Challenge OC, and let's introduce him. Nick, thank you so much for coming in. I really appreciate it.
Pleasure to be here.
I hear you're doing some pretty amazing stuff. You won a pretty heavy competition against some really good talent, so why don't you give me a little bit of an idea of what your company does?
Our company is a startup, a technology transfer at the universities of UCLA, Caltech, and the University of Louisville. It's based on 35 years of research of Reggie Edgerton out of UCLA.
Okay.
And we have come up with a treatment and a protocol to help reverse the effects of paralysis.
Really? So when you say reverse it, you mean literally someone can walk when they couldn't before?
We haven't accomplished that yet, but we've accomplished some other very remarkable achievements. So.
Fantastic. So can you give me a little bit of an idea of what's the basis and how this is going to work in the future? Where do you see it going?
We have developed two neuromodulators, or what are referred to as electric stimulators, and they're both designed to send an electrical impulse to the spinal cord and get it to sort of wake up and recall what it's supposed to do. These devices, in conjunction with physical therapy, have been giving us the results that we've realized to date, and which are, we have been fortunate to restore voluntary movement in 3 patients now who were completely paralyzed, and improve voluntary movement and function in 7 other patients.
Wow. So do you anticipate that it will actually ultimately result in fully walking paraplegics?
That is our goal, and we do believe that one day will be possible.
That's fantastic. I understand a little bit about the issue of the longer that they've had non-action, the less likely it is to recover. Is that true within your environment as well?
We still need to investigate the duration of injury and the potential benefits of our treatment. Right now, our patients are ranging somewhere between 2 and 3.5 years post-injury.
Okay.
We don't know what the extent is if somebody is 7, 10, or 15 years post-injury.
Right.
Every individual is different. Every injury is different, so how they will respond is yet to be seen, but we're very optimistic. So.
Now, it sounds to me like, I mean, even if there's not full recovery, you could reduce atrophy and nerve damage and all kinds of other things by having any motion at all. Is that an assumption that's accurate?
That is correct.
Okay.
The more you get someone to move, the more you have them stand upright, get gravitational forces involved, you have increased bone density recovery, you have increased lean muscle mass. This all enhances circulation and leads to overall improvement in a lot of different physiological functions, including control over blood sugar.
No, so that's actually a good point, because if the muscles are active and you have more muscle mass, then it works more efficiently, right?
Yes, so our patients are seeing better control, if not cessation of their onset of diabetes.
Wow, that's pretty fantastic too. So what's next for you guys? I mean, you just won something that's going to get you some press and some coverage. Where do you see you're going next?
Next is to raise the capital we need to make our commercial devices and then go into official clinical studies for FDA approval and get these to the market to the much needed patients in need. That is the challenge before us, and that is probably the most difficult part of what we're doing.
Well, it seems to me with all of our heroes coming home from Iraq and Afghanistan with pretty severe injuries, many of them being paraplegic or quadriplegic, you would think that the VA or the federal government, DOD, might be involved. Have you considered talking to them at all? We're
trying to reach out to them right now. All the science leading up to what we have today has been funded through either the National Institute of Health, Department of Defense, Christopher and Dana Reeve Foundation, Craig Nielsen Foundation, Michael J. Fox Foundation that has also contributed. So now we want to approach the Department of Defense to see if there's other discretionary money that we can possibly use to help deliver this to the veterans and other patients.
So I understand you won a pretty good chunk of change. Tell me a little bit about the prize that you won.
Yes, the award was $25,000 in professional services and goods, all to help move this project forward, or whoever was to win whatever entrepreneurial project.
We have a little bit of a tape of that. Why don't we go to tape and let's check it out while Nick gets his award.
I know that our winner will do great things as our first winner for this competition. Without further delay, the winner
We keep saying that, I know.
of the 2013 NextGen Challenge OC
The first
NeuroRecovery Technologies.
I really need to thank these two people because they literally twisted my arm and told me I needed to do this, okay, because I just, so there's a long story behind it. But some history behind this event, you know, it almost didn't take place if it wasn't for Bob and Jeff and Virginia here. So my hat's off to the three of you. I really appreciate it. Entrepreneurs appreciate this. Orange County appreciates this. So thank you. This really means a lot to me in particular because every little step I take and one step forward for what we're trying to do. As you can imagine, this is a very large project, but I promise you this will happen. Even if
We're back. Pretty cool moment, huh?
Yeah, it was very exciting.
Yeah, I mean, I can imagine that it validates a lot of what you're doing, and to be at an event with that kind of talent in competition is pretty amazing.
It was. I didn't expect to win. I thought my competitors there had a great presentation. I thought their products were really slick. It was quite a shock and surprise to me. It's very rewarding because it gets us a next step closer to where we need to be. So.
Mm-hmm. So what do you think the biggest barriers are? I mean, this is pretty advanced science. I mean, I'm not giving away the farm here, but where do you think your biggest challenge is going to be?
Our biggest challenge is the capital to get it to the commercial state.
So you're comfortable with the science, just if you can get
We are 100% so far with our
Good for
batting
you.
average, yes.
Have you looked at, I mean, it seems to me like the market's big enough to where, you know, it isn't like in some medical fields where it's like, well, there really isn't enough draw to get people to draw money. It seems like it's a pretty big market. I mean, what's the difficulty in finding funding? Is it just connections or?
The challenge with any medical device or biotech product, most investors would like a return within 2 or 3 years.
FDA takes longer than that.
Anything in healthcare takes longer.
Right.
So early stage money is very hard to come by because these investors want to cash out at an early period in time, and you have to respect them for that.
Right.
The larger venture capital groups or private equity, if you would, the ones who would take on the project at a later stage or who could fund the project today would like to see us further along.
Right.
So we're
It's
sort of
always
in
the
this,
first million chicken and the egg.
Yes, so we're in this kind of void here in this valley, and we need to kind of cross the two horizons to get to the point where a late stage venture capital firm would want to step up. So right now we're speaking to and going after a lot of high net worth individuals and private money.
Mm-hmm. So as a physician, it must be pretty cool to know that you may be on the cusp of making this happen. I mean, it's to me, it's kind of like the crown jewel of healthcare besides brain management, you know? I mean, being able to walk when you couldn't before.
It's extremely exciting, and you know, I'm the newcomer to the team. I've been with the team now for 3 years,
Okay.
but the real credit needs to go out to the scientists who've been sweating over this, and that's Reggie Egerton at UCLA, Susan Harkema, University of Louisville, Joel Burdick and YC Tai at Caltech. And there are scientific teams behind them. There are a lot of people, a lot of scientists. We probably have about 17 or 20 scientists contributing to this project.
Wow,
So,
it's pretty advanced medicine, I can imagine. Now, how does that work? Are they all parts of the company? Are they doing this for their tenured support at their universities? I mean, how does each one
there
work?
are some of the lead scientists have chosen to participate in the company. Others have not.
Oh, that's cool.
Yeah.
It's a good combination of the right things.
Yeah.
So if you had your druthers and you could get what you need, what is it that you need right now?
We need initial round of funds to get us to the next critical milestone, which is the development of the 2 commercial devices for front door of clinical trials, if you would.
And where would that development occur? Because I know regional funding is kind of important too. Or are you flexible?
No, we're very flexible, but we've identified engineering groups here in California as well as all within the United States, but here in California and other states where we can reach out and have them help us with the development process.
Okay, so I'd like to know, how do you get to be the CEO of this company? I mean, the 3 years, so somebody pulled you out of the world of medicine to come and do this. So tell me a little bit about that.
I was fortunate to be asked to join some scientists on Caltech back in 2007 in the Wireless Health Institute. We were working with embedded sensor technology and how to apply it to different medical devices.
Okay.
And that's when I met Professor Egerton. And we were working on a product for rehabilitating the upper extremity for stroke patients.
Okay.
And Reggie asked me to come over and join the team, help him with the spinal cord injury project.
Physician with a business background and a little bit of understanding of innovation, right?
Yes, I've been down this road before, so I had quite a bit of experience to help out.
Yeah, so you've had successful development in the past?
The last project I was on with UCLA was embedded sensor device, and we were successful at licensing that out and moving on to our next product, so yes. Before that, I had other ventures with healthcare I participated in. So.
Really? So I got to throw kudos out to some of your competition. Tell me who you thought your biggest competitor was in this competition.
The two competitors, actually, I thought it was going to come head-to-head with Pendler Motors and 180. And 180 is a new marketing group that will go out and solicit the area for the next opportunity for local vendors in whether it be food or something for your home, and it allows them to spontaneously put up an offer through text messaging.
Oh, okay.
And then Pendler Motors has really slick technology for incorporating a motorcycle chassis into a car body, and it qualifies as a motorcycle, so you'll be able to ride in the carpool lane.
Oh, that's interesting.
So
well, that sounds pretty slick.
Yes, and I thought either one of them would be the winners.
Well, I could see the second one in California, you know,
Yeah.
with the whole environmental background and everything without being. Well, that's interesting. I always like to know, you know, who are you sitting there going, gosh, I might lose to these people. So that's kind of a cool thing to know.
No, really. In fact, I was sitting in the back of the room when they announced it because I didn't really think I was going to win.
So at what point did you realize that this project was something you wanted to be involved in? I mean, was it from the immediate invite, or did you have to dig in a little to get to understand it? I mean,
oh no. Right from day one, when Reggie asked me to come on and help them, I knew that this was going to be an amazing thing. I was aware of his work. He shared with me where they were at. I knew the work they did at the animal level. He had shared with me the progress they were getting ready to take on the first human subject.
Okay.
And I knew, okay, it's just time.
Now, how does that, explain that to me if you could a little bit, because I'm not familiar. I'm actually a HIPAA privacy and security expert, so I'm on one side of healthcare, but not on the side where you guys are doing innovative development. So try to help me understand the difference between a true clinical trial and a human trial. How do you get to practice on a human without being in a clinical trial? What's the difference?
We go through a review process called the Internal Review Board, which is at a hospital or a university medical center setting. And that's the first phase of being approved by the FDA. The internal review boards of these institutions are an extension of the FDA.
Got it.
So we submit our study to them. They grant us approval. It's all based on risk. And once we are granted, we can proceed with very limited experimental guidelines and levels.
So the number of people, how you do it.
Yes, it's sort of referred to as feasibility or translational studies.
Okay.
So we have patients who volunteer, and then we proceed.
And then what selection process did you go through? I mean, not to get too specific, but I mean, was it the worst need, the best possible potential? I mean, how did you kind of pick your targets?
Professor Egerton and Professor Harkema decided that they were going to select patients who fit close to the category of the most severely injured.
Got it.
So in spinal cord injury, they're classified as either having a complete injury or incomplete injury. And they went and set up criteria to select patients who were completely paralyzed with little to no movement.
So you could truly see the gap and the gains, right? I mean, that makes sense.
We knew if we were
potential.
successful in this classification of patients, then we can help everybody below them.
Now, somebody referenced this as kind of like a jumper cable for your spinal cord. And it sounds like a pretty cool concept. I mean, are you literally just reconnecting electronics by bypassing the break in the spine? I mean, is that kind of what's happening, or are you truly stimulating something below it, and you're not really transferring from the brain to the?
No, we're not transferring. We're actually stimulating the spinal cord directly.
Okay.
The success of what was discovered was based on two facts. One, that the spinal cord is very sophisticated. It can learn, and it actually has the same programming as the brain does. So
Really?
think of it as a small mini computer, and the brain is the master server.
Okay.
So all the same programs and algorithms are sitting there. The second thing that was so overlooked was the value of the sensory side of our nervous system, our proprioception. When you have a spinal cord injury, the fibers below the injury are still there.
Right. So the wiring is still
The wiring's still there.
Ah, okay.
And our sensory nerves are actually still gathering information.
I love it. So they're like probes, but they have no way to report back.
Well, they're reporting back, but the report is not being acted upon.
Okay.
So what has been worked out was to stimulate the spinal cord to kind of wake it up so that it would remember and recognize this information coming in and then act upon it.
Interesting. Okay. So in that case, then, are you going to be able to take the messages from the brain, or are you going to have to use some sort of algorithmic calculation on balance?
The spinal cord has the algorithms. We just woke it up.
Really?
Yes.
Wow, that's amazing.
Now, we eventually, over time, communication has been restored to the brain, and then the brain has started to re-communicate back down.
Okay.
And we've just received a new grant to start looking at what's actually taking place at the cellular level.
Oh, that's terrific. So that you can see that if there's an adjustment that you can make or advance a
Correct.
little further.
We believe that several things are taking place, or a possible combination of the following. We believe there's might be a repair process taking place in a retrograde fashion. So new cells are being generated, new connectivity is being generated. We believe the spinal cord has probably rewired itself to a certain extent. There are also a lot of accessory nerve pathways within the spinal cord. These may have been rewired, but somehow, some way
So it's creating bypasses.
Correct.
That's what it sounds like. I mean, that's fascinating.
Yeah, so over time, we are restoring connectivity again to the brain.
Thank you for coming in, and I hope that you'll keep in touch with us and let us follow what's going on. I'd like you to let the folks know how they can get a hold of you, because you are looking for support, and I'd like to have people be able to follow you. So if you could give your website and a way for people to get in touch with that.
Yes, our website is NeuroRecoveryTech.com, and my email is nickT@NeuroRecoveryTech.com. And you feel free to reach out, email me. Be happy to entertain anybody who's willing to help at any level. So.
Well, that's terrific. Thank you so much for coming in.
Thank you. Pleasure.
Thank
Appreciate
you
it.
so much.
Thank you.
I'm Kevin McDonald, and you've been watching Eye on Business.
Welcome to Eye on Business, and this is our famous innovation segment, and we're now focusing on women entrepreneurs. So we're looking at innovative companies, innovative products, and innovative people. And today we have with us Pazit Ben-Ezri, and I'm going to get that right at some point. And Pazit, can you describe for us your product?
Yes, I designed a few years ago a soft bassinet that folds to a backpack in a second. This is a place for baby to sleep and to play, and for tummy time, and all the mom needs is just to fold it in a second, put it on her back, and she's ready to go everywhere, to hotel room, to grandparents, to friends, to the park, to classes, and the baby still stay in the same familiar environment. And feel
Sounds excellent. Sounds fantastic.
and lay there comfortably.
Okay.
So whenever I went with this product, everybody said, wow, this is so great, ready to white, can you make one for us too? And then I see the potential. It's really helped me as a mom to solve this problem to sleep everywhere.
But the key to this product is that it's mobile and you can fold it up?
It's soft bassinet. It's made by foam.
Okay.
And it's fold to a backpack in a second.
Okay.
Just hold the flaps, snap it together, and you put it as a backpack. And then I know as a mom that you really need two hands to hold your baby and turn it around and put him on a car seat or whatever you need. So I designed it in the way that it's going to be comfortable for me to carry. And it's very light. It's less than 3 pounds.
Less than 3 pounds. Now that's impressive. Okay.
And it's washable, so the cover goes out.
Okay.
That's
a big feature if it's a baby, right?
It is. You must have something that's washable for baby. And from there, I just decided that if it's helped me so much, I would love to do that. That more and more babies will be able to enjoy that.
So how did you turn this magic product into a business then? So you have the idea, you've made one, people are showing interest in it, but how did it turn into a business?
So I had like one moment when another lady asked me, and she shared with me that she had the same exactly issue that I had with my baby. So I said, this is it, this is what I need. And I started to talk with people around, and we have friends that used to sell some baby products, and they recommend me to go to some trade show. So without even have a company or prototype or anything, I called and I registered myself. It was 6 months after for the first trade show. This is the biggest one. It's called the ABC show. It was at Las Vegas then, and I registered myself, and I had 6 months to create business, to design prototype, to have it quoted here or in China, and so I just work days and nights to make it happen.
Okay, so now who was most helpful to you while you're in that stage, while you're, trying to change, progress from a product to a full-fledged business? Was there anybody that helped you along the way, or?
Not really professional help at that specific moment. I had many friends.
You're getting some cheering here, some fans. I'm not sure that's the Women in Entrepreneur group or not.
There is excitement.
There is excitement. No, that's always good.
It's not so loud, I guess.
So you were saying that there's some people that help you.
I didn't really know to go to get. I didn't know about SCORE. I didn't know about other organizations. I just looked online.
And we really want to thank you for joining us today, and we wish you all the best in your business.
Thank you so much.
And good luck with everything.
Thank you.
In addition to your business, good luck with raising those children in your famous mobile bassinet.
Appreciate it. Thank
Mahalo.
you.
So we're back with Pazit Ben-Ezri, and we want to find out the name of this famous product.
The name called Lulyboo Baby Lounge to Go.
Lulyboo.
It's Lulyboo Baby Lounge.
Lulyboo Baby Lounge to go. All right, that sounds great. Now, if people want more information about this, where do they go?
To our website at lulyboo.com. LULYBOO.com.
Thank you. That's excellent.
My name is Pazit Ben-Ezri. I'm the owner of Lulyboo Company, and you're watching the innovation segment on Eye on Business.